I had a bit of a general question about the trend for coronavirus in Singapore. Obviously, we've seen an enormous jump just in the last 2 weeks, from about 1,500 now to more than 9,000. It's a vastly different situation compared to the initial stage of the outbreak here in Singapore. So could the panel respond to the question, what has gone wrong in the last few weeks? And for example, in the foreign worker dormitories case, which obviously is driving a lot of the numbers at the moment, did authorities not start moving out the foreign workers out of the dorms earlier because it would have been hard for you to justify such a large-scale operation with potentially very high costs, with there being no outbreak in dorms, sort of doing that level of operation before seeing a big jump in numbers? Would it have been difficult essentially to justify doing so because of the high cost of such an undertaking?
Yeah, thank you. I think it's important to understand the rise in numbers, particularly coming up from the migrant worker dormitories, are not new cases of infections. As we have highlighted, the teams are in the dormitories testing workers, not just workers who have reported sick or have symptoms, but even workers who are well and with no symptoms. They are already enforcing safe distancing. They are separated from one another, not intermingling. But when we go in to do an active sweep of the dorms, testing them, we are finding that many of them, even without reporting sick, in fact, have been infected with the virus. And that's the reason why with this aggressive testing regime that we are doing to determine the extent of infection in the dormitories, that's why you see high numbers popping up every day, because it's a very aggressive sweep of the workers inside the dorms, even when they are not sick, even when they have no symptoms. What this suggests is that, in fact, the infections have been occurring for some time, starting very early, and it has been going on and circulating. Otherwise, you would not have been able to pick up such high numbers. So this is what we are doing now, going into the dormitories. We have a strategy to test the workers, to separate the ones who are infected from the ones who are healthy, and to ensure the well-being of each and every migrant worker in the dormitories and outside the dormitories. We have a strategy for that. That's one strategy, but as I've said before, we are tackling the virus on two fronts: the migrant worker front, and also the rest of the community, the rest of the general population. And there, if you look at the efforts, as I've said, we are seeing results. We are seeing the numbers of community transmission coming down, and that's why we want to go all out to bring the numbers down further, preferably to single digits, and then we can manage well on both fronts to take care of Singaporeans as well as migrant workers, and to tackle the virus situation holistically as a nation.
Can I just add a point, if you, excuse me? It's not just a question of cost, and I think it's an important point to make. This is not just about cost. If you look at the measures that were taken at the dormitories from the beginning of January, we reached out to the dormitory operators and asked them to raise the hygiene standards. Then we also produced lots and lots of materials to encourage the workers to protect themselves by arming them with knowledge of what to do in the face of this virus outbreak. Then we subsequently also implemented distancing measures within the dormitories, closing some of the non-essential facilities like TV rooms. But if you look at the measures that we are taking today, it has gone well beyond that. We are now asking the workers not to go to work. So from the workers' standpoint, this is a question of livelihood. Now, to say that we could have done this much earlier, I think really does not reflect an understanding of the workers' own concern. It would not have been so easy to tell the workers, please don't go to work, because we want to protect you. You have to do this in the context of a circuit breaker where all work mostly have come to a stop. We would have had to ask the workers not to cook for themselves, prepare the meals that they like at the end of the day, in order for them not to use the communal kitchens and interact with each other. We would have had to ask the workers, please don't go out on your rest days. Please stay in your rooms. Please don't interact with your friends. So it's not just a question of cost. It is also a question of what is necessary to break the transmission. And it is important for us to recognize this and not frame this really from a cost viewpoint and and as a result conclude that we didn't undertake these measures earlier only because of cost. It is not that at all. It is that to break the transmission, you really need a whole host of other things to happen. Work stoppages, closing shopping areas, preventing people from socializing from one another. It goes well beyond cost.